Hello, welcome back to Cusp of Coffee, the dental school podcast in which we talk about the highs and lows, the ups and the very much downs of dental school. My name is Uwais Adam. I'm a third year dental student.
And I'm Johan Klerk, a final year dental student.
Okay, so in about the last episode, we kind of spoke about us getting back into the flow of the general average flow of dental school, lectures, tests, clinics. Johan, you spoke a little bit about, your struggles in Crown and Bridge. So what's been happening in the clinic this week?
Okay, so this week I decided the best way to deal with my clinical problems is to not go to the clinic at all.
Oh, that works.
Just avoid the problem. It'll go away eventually, I'm sure. So so actually I had a bit of a weird week in that I didn't have that many clinics scheduled. I think because I've slowly been wrapping up a lot of modules. I don't have such an intense, clinical schedule every single day anymore. So I can kind of afford to take certain days and just do a bunch of other stuff. And this week in particular, we were writing Oro-Facial Surgery on the Friday, which is the one test that scares me the most. Oro-Facial Surgery in general is quite difficult when it comes to the academic side of it. And especially with this being our last semester test in final year, we are basically writing on, everything we've ever been taught with regards to Oro-Facial Surgery. So it was very much a large workload. Luckily, they ended up giving us a bit of a smaller scope 2 days before the test, which was really nice because it made me realize how much time I wasted on Monday and Tuesday by studying all the wrong things. But with that aside, a lot of time this week was literally just me studying, and in a weird way, it was kind of nice to go back to student life essentially. I feel like nowadays, you kind of get, especially as a final year, you kind of get treated as like a young dentist, just a very dumb young dentist, But it was nice to kind of fall back into my old routine of just having a few hours that I can literally just sit down and study. And, I don't have to worry about other admin that's going on around it. So weird as it seems, even though I had like this big stressful test ahead of me, it was a bit nostalgic to just sit and study and kind of feel like a normal student again. And the test itself didn't actually go that badly. Then again, you never know with Oro-Facial Surgery, but it was just kind of nice to put in the hours, go write the test, and then just like get a coffee after, and you're like, okay, cool, another test down. And I had this realization where every semester test we're writing now is the last semester test I'm ever going to write in dental school. After this, I either promote the exams and I don't go write exams for certain modules, or, I don't promote the exams and then I just have to go tackle that final exam. But with all the second semester tests, they're kind of structured like exams. So if you can at least do okay in the semester tests, chances are you'll probably be fine for the exams themselves. So overall, I kind of feel like when it comes to academics, I am now very much over the worst part of the trial. Now it's just all about like wrapping up stuff. But on the topic of Oro-Facial Surgery, so I think I've spoken about this before, but essentially when it comes to Oro-Facial Surgery, there are 3 boxes that you need to tick in final year. So 1 is you need to extract at least 50 teeth.
Yeah, you mentioned
2,
that.
you need to have what they call a difficulty index of at least 2.1. So all teeth are graded either as easy, so that's a 1, standard, which is a 2, and difficult, which is a 3.
So what's like examples of those teeth like in those criteria?
So a 1 would be like a tooth with lots of bone loss, kind of a perio tooth. Or say like a primary
Teeth
tooth
extraction.
that's basically that's like 2 weeks away from falling out anyway. That would be like an easy extraction. And then a standard extraction is pretty much just like hey, you know, I have this upper tooth, it's giving me a lot of pain. You have a look and it's like, okay, there's no PA or anything like that. It's just a tooth where it has a lot of decay. It needs to go. Like, you know, it's kind of just beyond saving. That's like a standard tooth, standard level of bone loss around it. So yeah, just kind of a normal tooth, but it's not viable in the mouth anymore. And then difficult is like an impacted wisdom would be like a difficult extraction. Or, for example, if it's like a lone standing molar that has endo treatment on it, where it's like very brittle and the bone around it is very dense, you know, so where the risk of complication is very high before you've even started, that would be like a difficult tooth. And so all the teeth we extract always get graded according to how difficult they are. And there's like some extra math that goes into it, but largely the idea is... Yeah, so largely the idea is if you get, let's say you extract 50 teeth, but most of them were period teeth, you're not going to pass because your difficulty level isn't high enough. Whereas on the other end of the spectrum, if you try to be like kind of a rock star and you go for all the difficult teeth and stuff to get your difficulty up, you're probably only going to extract like 1 tooth every session and not get to the 50. So it's all like a bit of a balancing act as you go. And then the third and final part of the criteria is we have what we call an independence ratio. So essentially, if at any point during the procedure the doctor touches the patient or touches any of the instruments, then it doesn't count as you being independent. And so the independence ratio in final year that you need to get is 90%. So if you just do some back of the napkin math, if you need to extract 50 teeth and you need a 90% independence ratio, it means you can only ask for help 5 times before your independence ratio falls below the threshold that you need to be at.
How effective do you think that is?
And so...
Like, you know, like...
How do you mean? Effective in what sense?
Like... effective, because I mean we've spoken about this before, and thinking about this, I mean I constantly think about how different the criteria is in oral surgery for you guys compared to how it is for me down at like UWs, because we don't have a set number of teeth, we don't have independence ratio, stuff like that. Like there is monitoring when it comes to like your quota books. There's like, you know, there's like certain boxes to tick, you know, like whether you were able to do it on your own and stuff like that, but it's not like measured specifically. And the only thing that's really counted and we have quotas for is surgicals. So like you need to have a certain amount of surgicals done by the end of final year to pass. So I'm thinking like if you compare the two, how effective do you think your system is at preparing somebody to, you know, pass? Because if I think about it, and let's say I'm really good at endo, but oral surgery is just, I struggle, and now I'm only allowed to ask for help 5 times. The minute I ask for 6 times, am I failing? Or is it like a special case? Or what is it? Because then I might feel less inclined to ask for help. Would that not put the patient at risk? Like, what do you think? Like, how effective do you think it is?
I think it's... Okay, let me put it this way. It's very stressful. And OFC, the clinical aspect of OFC has caused me a lot of stress over the past 2 years. But at the same time, I actually think it works quite well because it forces you to really think about the problem. So when you're struggling with a tooth, you know, you don't want to just give up because you're like, oh, like I only have 5 strikes. Do I really want this tooth to be the strike? And at least for me, I think it's forced me to seriously upgrade my extraction skills, because I realized, okay, I have a very low margin for error here. And so if I'm like halfway through a session and I'm kind of at the point where like I don't really know what to do, then it's like, okay, you know what, the cost of giving up is kind of too high. So let me just take a 2-minute break and think about this. And there's actually been quite a number of instances where literally just me taking 2 minutes to think about it and trying a different approach or trying a different instrument has actually led to me being able to extract a tooth on my own. And that's like a really nice learning opportunity, because I think you learn very well when you figure something out for yourself as opposed to someone just showing you. And I think especially with OFC, a lot of it comes down to knowing how things look, how things feel, how much pressure to apply. Someone can explain it to you and someone can show that to you. But until you do it yourself and you can reliably do it yourself, you won't have that confidence necessarily. And so I think despite all the stress that it has caused me, I think it has forced me to kind of level up as a clinician as well. Because so I've kind of fallen into the exact situation that you described now, which is that recently I ran into a few difficult cases one after another. And so I ended up with an independence ratio at the latest count of 88% because I've had to ask for help 6 times. And so again, if you go back to the napkin with the math on it, when you fall below that 90% threshold, it means you need to do 10 extra extractions to get back to 90%. If you've asked for help 6 times, it means you now need to do 60 extractions. And so it can quickly become a bit of a vicious cycle in that during the next 10, you have to ask for help again. And so it just keeps continuing. And it actually happened to a friend of mine last year, where by the end of the year she ended up extracting more than 100 teeth to get to that ratio. But if you kind of think about it, if you are not that confident and you maybe can't act independently, then it forces you to do more extractions. And because you're doing more extractions, you're getting better at doing extractions. So eventually it's kind of like this self-leveling system. Stressful as it is, I think it does work. So
when you put it that way, I can see the value, because I think especially what I've noticed in oral surgery, the tendency to want to give up is like it's a lot easier or quicker that you feel like you want to give up and just hand the forceps over. And I feel like I can see the value in a system like that, where it kind of forces you to have like some sort of consequence to just giving up. So I get that.
So basically during the studying process for OFC, when I wasn't in the library studying, the main clinics I tried to push included OFC because I now needed to make up for that. And so now I'm back at a point where I think I have 5 teeth left, and then I'm done for the year. So, it was a bit of a hiccup, but I was like, you know what, we're going to make it work. So, just a lot of OFC, basically. If I have to sum my week up in a little nutshell, then just a lot of orofacial surgery. So, yeah. How were things on Mr. Cusp's side of the world?
Mr. Cusp was, over the last week, stressed out of his mind for a microbiology test, because he kind of failed test 1, and so he kind of needed to pass test 3, because so for like microbiology, a lot of like the other modules, we write tests like throughout the year, and by the end you need to have obviously like your CAM mark. So your total mark of like all your assessments before the exam needs to be a total of at least 50%, because it counts 50%. So you need to make that mark. Then writing the exam, you need to obviously get 50% there. So then add it together, you pass. And so the first microbiology test, I even spoke to you about it early on in the year. It was like one of the first third year tests I wrote, and I got like 47% or something. And I was like, oh my goodness, like I haven't failed a test in so long. And so going into test 2, I kind of like studied a lot more, and it was like a lot more preparation. And the mark that came out was 57%. And I was like, okay, I got a 10% increase, but this is not what I was hoping for. And so going into test 3 now, I was like, the stakes are a lot higher. I can't afford to fail. It's the last test we're writing. I'm pretty sure there's not a 4th test, and I think they cancelled it. So there's like 3 tests. I failed 1. I barely passed the 2nd one. I need to do decently on the 3rd one. And it was quite a lot of work. And so I was quite stressed for this test. And I genuinely find it very difficult to learn work that is just like, brute force memorizing. Like when it comes to things like, even difficult modules like pharmacology and stuff like that, when it comes to like Max Vac or, like conservative dentistry, stuff like that, where it makes sense to me. I can understand the pathways, I can understand the explanations behind things, then I remember it. When it comes to microbiology, I need to remember like 500 different fungal diseases of the feet. Like, I'm not gonna get it right. And so I'm just brute forcing, trying to memorize random Latin words so I can pass this test. And we walked into this paper and it actually went not too bad. Touch wood, because we haven't gotten the marks back. But most of my attention was kind of focused on that. Like, even in the clinic, I was thinking about how I needed to go home and study. So it was very much an academically stressed week for me.
Yeah.
My journey in pros continued as well. I had to do jaw edge, and my patient was biting like the skewest bite I've ever seen in my entire life. Like, I kept asking her, please, can you just bite your normal bite? Nope. She's going to bite like she's biting on a wire as thick as like my keyboard. Like, she's just biting skew. And I was struggling there. And because I was struggling, the supervisor nicely downgraded my mark. So I was like, all the progress we made in the podcast last week about pros is down the toilet this week, because I'm back to a 50-something% for the session. But nice. I was like, you know what? That's just part of the process. I'm going on a try-in soon, so we'll see how that goes. And then I had a bit of an interesting session in cons, because I did that thing, where you plan to do something and it just completely goes the other way, where I essentially planned to do a filling. I took a radiograph, I checked it out, it was like, okay, it's going to be a deep filling, but should be fine. Started cleaning out the cavity, and I realized I'm very close to the pulp, because it's going very deep. And I was like, oh no, this is not good. And so the supervisor came to take a look, and the problem is I didn't have great visibility, because my patient, he's just constantly closing his mouth and moving his tongue all over the place, and like I needed to and I didn't have an assistant. I needed to retract all that myself. And my biggest issue was the fact that I didn't start off the session by putting on a rubber dam, which I really just should have done, but I didn't. And so struggling for visibility, he's moving his tongue around, struggling with isolation, crowding on the teeth as well. And then also my chair light was very dumb for some reason, UWC problems. And so very dumb as well. Supervisor came to take a look. She's like, your chair's light is very dumb, eh? I was like, yeah, I know. I'm trying. At one point I went to go look if they had a headlight, and there wasn't, but I tried. And so eventually she looked at it and she's like, you know what, like there's still a little bit of like softened dentine here that you need to take out, but I'm very scared because you're very close to the pulp. And so she said the dreaded words. She was like, just do an IPC. And I was like, oh, great. And so then I started prepping to do the IPC. And so I put on some calcium hydroxide, and then finally somebody could come and help me out. We mixed some calcinol. I plugged it in there. And again, this was like difficult because the mixing ratio for that material is like 5:1. And you mix a certain amount, and then when you get to the cavity, you realize it's so big, you need more. And so I needed to mix more, and then mix more, and then mix more. And eventually I plugged that thing. And doing that, it just like, yeah, you know what? Like, you don't get an IPC quota really often. So it was like, okay, cool, I get one. But it didn't feel like a win, because in 5 or 6 weeks, I need to reevaluate this tooth, take that out.
Yeah.
And most likely it's going to end up being an endo anyways, because I mean, the success rate of IPCs, not that like from what I've seen, isn't that great either way. And so it didn't feel like a win. Whereas when I walked into that clinic, I was planning for a win, because I thought I'll knock out like 2 or 3 fillings, maybe. Never ever think that. It's never going to happen. But yeah, so that was essentially it for the week. Like clinic wise, I was kind of like, it kind of was a very average week. Like I started on the down with pros, picked up a little bit with cons, and then it went right down again. My perio session my patient cancelled, so I had a free session there.
Dude, that's like a perio classic right there.
Yeah.
That's a killer.
And when they give me my perio clinic from the start of this year on a Friday in the graveyard shift, so Friday at 2:00, the entire place is cleared out, everyone's gone home, and I'm there like scaling teeth. Like, of course the patient's not going to want to come. It's the weekend. So yeah,
Nice,
that was that
nice.
cleared out. I also had a bit of a cool moment in the lab, actually, because during my perio session, I essentially was free, and and barely anyone had patients. So I went over to the lab, and I was sitting there, and some of my classmates were doing their record blocks for their pros cases, and so they kind of were like, "Uwais, can you like help us out with this?" And in my head, I was like, "Okay, like I'm not the best at this," but I started doing it, and I realized like I'm way better at it than I used to be. And even they were telling me like, "Oh my word, like you're so good at this," and I was like, "Huh? Really? Am I?" Like, it's just. And I remember how it used to be like last year, when we were doing it for the first time, and I feel like I've picked up so many different tricks that you just learn, and that you now automatically apply. Like, how hot to make the wax knife, and how to roll the wax, what's it called, the rim, way better, and how hot to make the wax, and when it's the right point to actually, put one piece of wax onto another. Like, so many different things that you pick up as you make those mistakes. And I kind of had like a really cool moment there doing that, and it kind of like in my head it clicked, like, you know what, like if you do something enough, eventually there's no point, like there's not no point, but what am I trying to say? There's no option but to get better at it. Like, you're just going to get better at it.
Yeah.
Because you just keep doing it over and over and over again. It's rare that something happens and you're just like really good at it the first time. And so it kind of was like, you know what, it's fine. If I didn't do so many fillings in preclinical, I wouldn't be decent at it right now. Same thing applied to the oral surgery. If I don't keep doing extractions, I'm not going to be good at it. Like, eventually, you just have to be at the point. It's just natural progression. You will be at the point where you get better at it.
Yeah.
Yeah.
Yeah, I feel like so many things just clicked in my brain when you were saying all of this. I feel like it's another one of those instances where we had like basically the same experience and the same lesson, but it's just like a bit of a different context. So the moment you started talking about like having a session where you planned one thing and things just went completely in a different direction. So one of the clinics I had this week was an afternoon pediatric session. And I was actually like really keen to go and do this session because the plan was to do two things for the first time. One was to do nitrous oxide sedation, and the other was to do a pulpectomy, which apparently, at least in our hospital, it's actually very difficult to get a pulpectomy case, and like the majority of people graduate without necessarily physically doing a pulpectomy themselves, other than in preclin, just because it's really hard to get the right cases for that. And so I was like, okay, cool, I get to sign off my nitrous quota and I get to try out a pulpectomy. So I was like really just like prepped for everything. I had a lecture before the session, and during the lecture I completely zoned out because I was just reading up on pulpectomies. And I was like, in my head I already knew what I was going to do. I was like, I was going to do this, and then I was going to do that, and I was like, this should take me that long, that should take me that long. I was like, in my head I've already done this procedure. So I walk in, and like patient's there, we look at the radiograph and stuff, and the supervisor is like, let's just do a pulpotomy. I was like, wait, what?
No.
I already have all this stuff. What
That's
do you
the
mean?
worst.
And so, but I mean, obviously it's to the benefit of the patient if we can get away with just doing a pulpotomy.
Yeah.
But then I was like, okay, so just like I completely had to change gears, and now I had to do a pulpotomy. And what was really interesting is the procedure actually felt really routine to me. I was like it wasn't a problem to do the pulpotomy. And I found it interesting because obviously I was terrified of pulpotomies. Like I've told this story multiple times at this point, but yeah, I mean, like it kind of just reaffirmed for me that often with a lot of challenges, it's literally just the thing of what you said now about just basically putting in the reps. And I think it's just like a nice thing to keep in mind for life in general. So recently, as a way to kind of, I guess, keep my stress levels at bay, I've been running a lot, and I've been running around campus. And so I'm kind of trying to work towards running a 5-minute mile. And I remember a few weeks ago, I basically did my first lap around campus, and that run completely destroyed me. Like, I couldn't even walk properly the next day. And I just remember like feeling so exhausted, and I was just in a lot of pain. And even during the run, I got stitches, and even breathing hurt a bit too much. It just wasn't a fun time. But since then, I've gone on quite a few more runs. I've put in a few more reps, and now it's just become a lot easier. And I feel like I say this every week, but you know what? I'll keep saying it until the day it stops being true. Is you just gotta trust in the process. Like, some days, literally, it's just about putting the one foot in front of the other. Like, it's like, and like in your head, it's really easy to be like, yeah. Just the process, you'll get better over time. But in the moment, I mean, it's difficult. Like, I remember during that first run, I was like, why am I doing this? Why don't I can just stop? I can literally just stop. No one's forcing me to do this. There's no one on campus. Literally. There's this security guard at the gate. He probably thinks I'm insane.
How far do you run? Like, how kilometers wise?
So, like I said, I'm trying to do a 5-minute mile. So each time I just run a mile, which is about 1.6 Ks. And I just try to see what's the quickest I can do that. Yeah. But on that first one, I was like, this is so stupid. Why am I doing this? I'm not even close to 5 minutes. Like, but I was just like, no, just put one foot in front of the other. Don't think about it too much, And I kept telling myself that for run 2, run 3, run 4. And now my time has gone down a lot. The first run was close to like 9 minutes, and now I'm down to like 7 minutes 30.
Damn.
And it's like, you look at the little, and I have like an app that I track it on, and it's like, you can see the graph going down, and it's like, oh, that makes sense. But in the moment, you're like, I could just stop. This is stupid. This is not going to work. I'm never going to get better. And so, I feel like very much the same, just coming back to clinics. It's like, in the moment, you're like, yeah, cool. Let me go drop out, because obviously I'm never going to figure this out. That was me after my first pulpotomy. And now it's like, oh, okay, we're doing a pulpotomy today. Okay, it's fine. I'll just quickly go do it, and then I'll leave. I'll go study for my next test. And it's like, whoa. Like, mentally, it makes complete sense. But emotionally, it's like, you kind of got to just push through it sometimes. Yeah. You got to make it work somehow.
It's fighting that negative self-talk. Because I find there's always a break between your logical brain and what that's telling you and what your emotional brain is telling you. Even if something doesn't, like, even if you get upset over something and your logical brain is telling you, there's no reason I should be upset about this, everything is fine, but your emotional brain doesn't register that. And that's the part that gives you all those negative, that negative self-talk. Like, similar to you, like, I'm not really running, but I've been trying to be more consistent in the gym because I kind of fell off the wagon about a month ago. And so I've been like cutting on my diet, and I've been like, trying to get more in the gym. And the negative self-talk is like the biggest thing you need to deal with. Like, sure, you get hungry and you can't really eat because you're cutting and you don't have that many calories left to spare for the day. But just getting into the gym, like, there's been times where, like, about like, maybe, okay, like this week I'm on holiday, but like last week or the week before, I've just been like so tired from campus, like bags under my eye, like duffel bags under my eyes, tired, stressed because I'm writing that microbiology test. And I drove myself straight after the clinic to the gym, and I literally sat in the parking lot in my car for at least 10 minutes thinking about how I just don't want to go inside. Like, like it was just, I literally caught myself doing it, and I was like, oh my God, I'm literally sitting here not wanting to go inside the gym, like so tired. And I was just like, my voice in the head was just saying, like, just go home, take a nap. You have to study later anyways. Like, why are you doing this? Like, you're not going to even, it's like, just go home, sleep, and then you can study. Why are you going to waste your time here, then go home, and then still study? I feel like for me, if I have something to look forward to, I can push through what I'm doing right now. Like if I know, like I feel like that's why I kind of do well on the Friday clinics, even though it's like junk because you have to go back at 2 p.m. I kind of feel nice walking out of the hospital because I'm like, okay, I just got to push through this clinic and then it's weekend, you know? But when it comes to sitting in the parking lot to go to gym and knowing you just have to go home and study, it's not great. And then you have to eventually just like force yourself to get out, go inside, and once you get in the flow of it, you're like, okay, it's not so bad. Like, I'll just do it, you know? But it's fighting that emotional brain. And that's negative self-talk. That's the most difficult thing you can ever do.
Yeah. Honestly, I feel like, and I think especially what you said about like that flow, I feel like this happens a lot, especially when it comes to like clinics, or especially I remember like back when I still had to do a lot of prosto lab work, like getting myself to actually go to the lab and just start doing lab work. It would always feel like this massive thing. Or it's like, if you have like an early morning clinic, it's like you wake up and you're like, what, you want me to put a needle in somebody in 20 minutes? Like what? Like that doesn't compute. But I think a lesson I learned last year that I still tell myself a lot when I have days like that, where it's like, even the other day, it was like 4:00 in the afternoon and I still had a bit of lab work left for the day. And I was like, I could go home or I could just go finish it. And then that's one less thing to worry about. And basically what I tell myself is like, are you willing to be uncomfortable for just 5 minutes? Because even though, for example, that lab work ended up taking me close to like 45 minutes, but it was only the first 5 minutes that felt bad. But after that, you're like, okay, well, I'm here now. I already have all my stuff, you know, I have some earphones in, like, flip, let me just finish it, you know? Same with like going to the gym. It's that first 5 minutes, but once you actually start the workout, it's like, okay, well, I'm here now. Let's go for it, you know? And so I think what I often try to remind myself is just don't think of it as it's an hour of this thing, or it's like I had this whole day and now I need to go spend the whole evening working on this assignment or doing that or doing this. It's literally just a thing of like, am I willing to just be uncomfortable for 5 minutes? Because even though the emotional part of my brain doesn't accept it, the logical part of my brain is like, listen, if you can just get through that 5 minutes, you'll be okay. Like you will survive. You just find some way to get through that initial 5 minutes, and you can usually just build up a new momentum from there.
Yeah, and I think it's also about like thinking about where you want to be, you know? Like when about the lab work, like you can go home and relax, but I want to be able to go home and be at the point where I want to be the person who goes home and I know that my lab work is done. You know?
Yeah, because I feel like
compared to being
I feel like unfinished lab work, it weighs on your mind in a way that it shouldn't be allowed to have that much authority over your mental state. But when I have unfinished lab work, it just weighs on me every single day, and I go to bed and I'm like, Johan, why don't you just flip and do the lab work? What's wrong with you? Like, it's just like, it'll be like the smallest thing where it's like, I just need to make one like bite block, but it's like, oh, come on, you another day and you didn't do the bite block. But then I'm at the hospital and I'm like, I really don't want to do this bite block, you know? So I don't know, there's some stuff where it's like you literally just flip it, just force yourself to do it, because you'll be so much happier afterwards having done it than like dealing with the constant like just those nagging thoughts like I still need to do this, I still need to do that. And especially when things get stressful and you have a ton of other stuff to worry about, and it's like that little bit of extra stress suddenly becomes too much, you know? And so I'm all for like when it comes to like small battles, just pick the battle, just go for it. Like it'll maybe suck at the moment, but like when the big battles come, you don't still want to be stressing about all this other stuff. Like, I mean, now at the end of the year, we're all worrying about quotas. There's just a lot going on. And I'm so extremely thankful that I don't have like a ton of lab work left, because I front loaded it at the start of the year, where, you know, a lot of other people were relaxing. And I was like, oh, another afternoon that I'm alone in the lab. Yay. really living the final year life, you know. But it was like the small battles, and I chose to just fight them right from the start. And now that kind of the big battles are here, I can just focus on that. Like, for example, I had all this downtime this week. I could literally just sit and study for OFC, and I'm so grateful that I could do that, instead of being like, okay, I'm going to study 1 hour OFC, now then I need to go for 2 hours to the lab because I need to invest this denture, and then I can do that, and then I can do that. I could just be like, no, I'm just going to focus on this thing, knock it out, focus on that thing, knock it out, which I think is just, for me at least, it helps me to stay sane, not having like 10 million things to worry about, where it's more just like, okay, I have 3 or 5 things coming up, but that's all I need to worry about. So, you know what? I think I can manage that at least.
Yeah. It's like I heard something on this podcast. We spoke about it, but it was the deep dive with Ali Abdal. So he had this, I can't remember the guest's name, but they were talking about like, you know, like balancing your life and your relationships and things like that. And essentially, like, one of the things that she said was like, you need to kind of like look forward and like sort of identify yourself as the person that you want to be already. Like, don't say like, whether it's something big or small, like whether it can be the gym or doing the lab work. So like, let's take the lab work for example. It's like, not like, oh, I want to do my lab work and I need to do my lab work, and so therefore I just have to do it now. It's like, you must rather say like in your head, like, I want to be the person that is at the end of the year less stressed for the lab work, and so therefore I am a person who does their lab work now, ahead of the time, and who plans ahead. And by identifying yourself like that in your brain, it kind of like clicks, and it's like, oh, I am this person, and I am going to do this because that's who I want to be. So same thing with the gym. It's like, sit outside for 10 minutes and you're like, oh, I don't want to go inside. And then you think like forward, and you're like, I want to be the person who looks back in a few weeks and says, I'm glad I actually just went to the gym. And the thing about something like the lab work or even the gym, like, after you're done, you're never going to regret that you did it. Like, there is never going to be a moment where you're like, I probably shouldn't have finished that lab work. I probably should have procrastinated. Or, wow, I shouldn't have gotten fit in the gym and gotten hench. Like, that's not good for me. Like, it's not going to happen, you know? Like, rather delay things that's not going to progress yourself, like, personally, to get to be the person that you want to be. That's fine. But things that you know is going to become or make you get closer to becoming the person that you want to be, rather just, like you said, suffer that 5 minutes of being uncomfortable and do it. And you know, something silly that I do, I've actually found myself doing it without realizing until recently, is when I'm in like a headspace that's like not conducive to thinking clearly. Maybe I'm thinking about something else, and I need to just focus on something in the moment. Usually it's in the clinic, or sometimes it's even studying. Sometimes it's even in the gym. Like, you have maybe something else is on your mind, something's preoccupying your thoughts, and you need to just block it out and focus on what you're doing. Sometimes I literally just, like, it looks stupid, hey, and like it might even sound dumb, but sometimes I just like shake my head, like, you know when you get out of the pool and you just shake your head till all the water can go off? Like,
yeah,
I just like shake my head. It's like, okay, snap out of it now. And that physical manifestation of just being like, just snap out of it now, it actually helps. Like, it kind of just, it like shows me like, okay, I need to just stop now, focus on what I'm doing, get through this, suffer being uncomfortable for a little bit, get into the flow, and afterwards there'll be time to deal with everything else. And it's been helping. So yeah, if you get overwhelmed, just shake your head like a dog coming out of the pool and you'll be fine. Like, it works.
Yeah, yeah, I do like a similar thing. For me, I just kind of do like a little bit of a hop, like just add a skip in one of my steps. Yeah. Because it forces me immediately to go upright, otherwise I'll fall over. And then every single time I do that, it makes me realize how hunched over I am, because it's like I feel like I'm mentally weighed down, and so I just naturally kind of start hunching, and my shoulders are drooping, and it's just like it's not this confident kind of stature anymore.
Yeah.
And whenever I do that, like I just feel lighter, and I'm like, oh, yeah, like, you know what, like maybe it's not that bad, and it's just like a bit of a reset point.
Yeah.
And I know they talk about it a lot when it comes to like sports. I remember when I used to play tennis, they would always talk about like having a way to reset. And so back then, whenever I was on the court, I would do the little skip, and that would just be like, okay, let me just, you know, feel light on my feet again, like just air off some of the tension. And I kind of kept that habit going into dental school. And I think that's really, really useful, actually. It sounds, like you said, it kind of sounds stupid until you're in a very stressful situation. And I always say this, when it seems like everything is going south, even the smallest bit of hope is appreciated. So even just that small little thing where it's like, you know what, they can't take this thing away from me. It's like everything else I'm doing today just isn't working, but at least like I still have this one thing I can do to maybe just give myself a little bit of hope, to just reset my head a little bit and just try again. I think there's a lot of value in having small stuff like that.
Just to shaking kind of, it off,
Yeah. So actually, to kind of round off the episode, since this was a bit of a more academic week for me, I wanted to chat a little bit, and I think you're in like the perfect position to talk about this, to maybe kind of talk a bit about the transition in mindset when it comes to academics, specifically like tests and marks and things. Because obviously once you start working in the clinic, obviously a lot of what you've been studying is now kind of contextualized, and you're like, oh, okay. Like in the past, you needed to know stuff so that you could answer it in the test, and that was kind of the extent. But now it's like, oh, I actually need to know this prescription, for example, because I need to write it for my patient. So it's like, it contextualizes a lot of stuff, but because it contextualizes a lot of stuff, the useless, quote unquote, useless work feels even more useless.
Yes.
It's just like literally, I'm never, ever going to use this in the clinic. So why am I studying this? So I feel like it kind of polarizes the way you look at like the work that you need to study. And I feel like I've seen this in myself. I've seen this in a lot of other students. And what's interesting for me is I noticed that people kind of react in two ways, in that, and generally speaking, there's a bit of a dip in academic performance once you start spending more time in the clinics, just because, your priorities shift a little bit and you don't have as much time to just focus on, being like an academic weapon the whole time. But I've noticed people kind of react in two ways, in that either they double down on academics, in that they're like, okay, cool, I'm just going to check out my social life entirely, because that's the only way I can maintain academics, for example. Or they kind of go the other route, in that it's like, you know what, I don't actually mind the fact that my academics are going down, as long as my clinics are okay and I feel like I'm improving. But either way, regardless of which route you take, it is kind of like a tricky mental thing, and it can be a bit painful as well. So I feel like you're kind of dead in the middle of that process. So how has it been for you? And like how has that priority change been for you when it comes to like academics? Because obviously to make it up until the point where you are now, you had to be a very strong student. Like you don't just magically get to third year dentistry without knowing how to destroy a test. And now like, your marks start going down. It's like, it becomes almost like an identity thing. So like just what are your thoughts on it now that, you've been through like a few quarters of this year now?
It's actually like it's like you're asking this at the right time, because I've been thinking a lot about it. There's something you mentioned, before I get into it, something you mentioned about work that you don't necessarily see the value in. That's like microbiology. Like there's certain things in there where it's like, yes, I need to understand oro-facial infections. I need to understand infection control, transmission of diseases, communicable disease, all that stuff. But like dermatophyte infections of the feet, like, do I really need to know this? Like, this doesn't make sense to me. Why? And I find when you complain to other students, they kind of agree with you and they kind of feed into that. And when I speak to a dentist, like I spoke to a dentist in the week and I was like, oh, there's just so much stuff that's not necessary. And they were like, everything is important. You need to learn it. And in my head, I kind of like push back on that. And I'm like, yeah, but you sitting in private practice, you never ever use that information. Like, don't lie, like when you're doing a root canal, you are not thinking what bacteria is causing this root canal infection. Like, you're not doing that. Like, that's just not how it works. I understand it's important, but don't tell me that everything matters, Inherently, the course is designed for you to understand to have a broad understanding of everything.
Yeah.
I get that. But for somebody to say everything matters and stuff like that, it just doesn't sit right with me, because, yeah, I do need to know certain things, but when it comes to a lot of other things, it's like I'm studying it just for the sake of passing, because they want me to, and because they're not going to let me progress to 4th year or 5th year or become a dentist if I don't learn about toe infections. So I'll do it. And that, like you said, becomes polarizing, because now you are used to getting a certain mark, or you're used to putting in a certain amount of effort in a certain amount of time to get a certain mark. It's like an equation. If I put X amount of time with X amount of effort, I'll get this mark.
Yeah.
Now you progress and you're in 3rd year, you have way less time and way less effort to put in, because your energy expenditure is so high in the clinic and doing all of your other things. And then on top of that, there's all this work that you just feel personally is unnecessary. And so there you struggle with this crisis now. And that's where I'm at, because like last year in 2nd year, or at the start of this year, a bunch of us got an award, like a merit award or something, because we got like over 75% averages. And like early on this year, it hit me as like, oh, I might not get that. Like, that might not happen this next year, because my marks have been reduced to 60s now. 60s, couple of 50s. I failed a couple tests. And overall, like, I don't think I've clocked in an 80% in a while. And that you battle with that, because to get into dentistry in matric, I needed to kill myself studying to get in here. And you get I got the best marks I've ever gotten in my entire life. And I told myself, I'm going to study my ass off. I'm going to get into dentistry, and then I'm done. Like, I just want to pass. I don't care. But even though you say that, your logical brain says that, emotionally, my brain is still like, but why aren't you getting good marks always? Like, and the thing is, you study so much. Like, I studied so much for that microbiology test, and I still just didn't get what I wanted. And that really, really can bog you down. And I think the way that I'm kind of dealing with it, I mean, it's not perfect yet. I want to hear definitely your thoughts on this, being, so far ahead. Also, something else that plays into this, what we spoke about before, the comparison trap. Because there's certain people in your class that no matter what happens, they just are amazing at tests. They're just really good at studying. Some people are getting 90s, 80s for all of their tests. Like, they're getting triple merit awards, and I'm struggling to get to break even on a distinction. Like, you start comparing yourself as well. And we've spoken about that in the past. And so the way I'm trying to deal with it is kind of like, again, look forward past dental school. And I kind of am leaning into that clinical route thing. I feel like I can't be the person. I'm just not the person who can give up my social life or my free time to be constantly studying. I'll go insane and I will definitely drop out. So that's not me. I know people who do that, and if it works for them, it does. But for me, I need free time. I need to go out with friends. I need to spend time doing what I like, or I will be miserable. And so my only option left is to do the other thing, where I kind of am on my way to making peace with the fact that I just have to try my best. And if it's not in my identity to be a top performing academic student, then I damn well will make sure I'm a top performing clinical student, because it's either one or the other for me. I don't know how some of the people who do really well academically, I don't know how they are clinically. Maybe they have both. I don't know. But for me personally, it's getting to the point, and I know fourth year is apparently even worse, So it's getting to the point where I'm needing to make that decision, like, and change my identity away from being a academic student to being somebody who just tries their best academically. You know, like, I need to know my stuff. Like, I'm happy knowing that I know my stuff, you know? Like, if I write the pharmacology exam and I don't get the greatest mark, I need to be able to be comfortable knowing that I understand the medications and I can manage a patient with it. I might not be able to get the best mark in the paper, but in the clinic, I'll know what I'm talking about. And that's kind of how I'm approaching it. Like, I'm still benefiting my patients. I'm still giving them the best quality of care. I'm still being a good clinician. I just might not do the best academically, but I'll try my best. But again, a bit iffy on that. Like, I'm still wrapping my head around it. What are your thoughts like on this?
So, actually, I feel like I kind of had to confront this recently again, because two things happened very shortly after one another. So, I was in the clinic one morning. I literally just popped into the prosto ward quickly to just check if some of my lab work arrived. And I ran into Dr. Pereira, one of the dentists that I have gotten to know quite well over the past year. And we were just having a quick chat about life. He was asking me, like, how's Coda going, all that stuff. I was like, yeah, you know, just kind of gave him the rundown. And then he was like, oh, so do you think you're, you know, going to finish your degree like cum laude? And it was really interesting because when I started dentistry, that was like a big thing for me, was like, like finishing cum laude. And over the years, I worked really hard to maintain a very high average up until 2021, when I had to repeat. And it felt like I kind of had a free year in that basically nothing I did counted towards anything academically. So I could kind of do whatever, and there wouldn't be like an academic repercussion. And that like fundamentally changed, I think, my outlook on dentistry and life. And I realized, I essentially realized what the opportunity cost was of that high average, because all of a sudden I had the time and the energy to do all these things that in the past I had neglected because studying comes first, you know?
Yeah.
And especially this year, you know, kind of finally coming in as a final year student, and I have to deal with, you know, academics and clinics all at once. Again, I regarded academics in a bit of a lower light than I did in the past, because all of a sudden I was very keenly aware of what that percentage mark at the end of the year was actually costing me in terms of time and life experience. And I remember like looking at Dr. Pereira and being like, no, I don't think I will, with like a smile on my face. And I was like, you know what? Not because I don't think I can, but because actively I don't want that, because I know what it would cost me to get that mark. And I even told him, like, you know what? This is the last year of my life that I get to be a student. After this, I'm permanently leaving this phase of my life. And I mean, I talk to dentists that are like, yeah, dental school was tough, but, you know, it's still university. Like, it was kind of fun. Because the repercussions of everything you did, like, they weren't as bad as when you're, say, like a fully independent person. And, you know, they were like, and a lot of them said, like, you know, once you graduate, it becomes a lot harder to find time to hang out with friends or even to meet new people, because you're just not in an environment where it's people your age, with people your interests. Like, most of the time you're spending your time at work, and that's not really where you make friends. Like, you're not going to become buddy with every patient you see, you know? And what I realized in that moment is just like, yeah, like, I'm not going to get cum laude for this degree, even though it was something I cared about for like many, many years. It's kind of what I mentioned in one of the previous episodes as well. Like, why should I be beholden to a version of myself that knew less about life than I do now, you know?
Yeah.
And so I was like, I was like, you know what? I'm going to make this choice where I'm not going to spend as much time on academics anymore, because even I want to become a better clinician, because in the long run, that's what's going to move the needle in my life. And so it's kind of like, I mean, I spend free time looking at articles, reading up on certain stuff, but that's because I want to get better in the clinic. For example, with peds, I actually read, I think, something like 19 articles of like pediatric related studies this year that were not part of, my curriculum, but it helped me to be better in the clinic. So it's like, I don't think I'm necessarily a bad academic or whatever, but it's just a bit of a change in priorities. And so what kind of hit the nail on the head for me is a day later, I got an email from the university, and it was a super generic email of like, dear student, it doesn't have your name, anything. It's just like, dear student, an obviously copy pasted kind of email.
Yeah.
And it basically just said like, oh, we've noticed that based on your first semester, the marks from your first semester, you're going to have a lower, like, can I say academic performance compared to your previous years of study, because they look at like your average over the years. And it was kind of a passive aggressive email. I was expecting something nice, but they were like, yeah, you need to like focus and put in the work and all this stuff. And I was like, cool. Anyway, so I just closed the email and I went on with my day. And if I had received something like that in third year, I think I would have, I probably would have cried, have a breakdown, all that kind of stuff. I was like, cool, anyway, let me go buy a coffee. Like, I was just like, whatever. Because like, I was like, you know what? Like, they don't care about me. They couldn't even bother to put in my name. And now they want to tell me how to spend my life as a 20-something. And I was like, listen here, buddy. Like, this is not gonna fly. You can do whatever. I know you care about the university's pass rate or whatever. I don't really give a shit. I just want to focus on me. As long as... So the only metric I feel like I really care about nowadays is, am I moving towards what I perceive as a better version of myself? And in the past, a better version of me would have been, someone that gets even higher marks than I do now. That's like the obvious way to think about it. But nowadays, I'm like, okay, the better version of me is someone who can do these procedures better, do these kinds of procedures, quicker, do more advanced kind of procedures, that kind of stuff. Like academics doesn't really factor into that. And so, yes, because I kind of made that choice at the start of the year where like, you know what, this is my last year at university. I'm going to enjoy it. I'm going to work flipping hard because as much as I like university, I don't want to do another extra year. So, I'm still working hard, but it's like, I am not going to optimize for the mark at the end of the day. Because also the other thing I realized, and I guess this is something that like you never really get taught in dental school, but something I realized really profoundly when I started spending more time at private practices is that no one gives a shit how you did in dental school. It's because like when you're out there, they don't care what you did.
Do now,
all they care about is like, what can you do now? Like, are you a good dentist now? Yes or no? Like, I don't care what, for example, how many microorganisms you remembered for that final exam. It's like, can you do this endo, yes or not? Can you retrieve that file, yes or not? If no, okay, then like, get out. We're going to send it to someone else. So like, and the only people that care about your university marks is the university. Because let's say you want to specialize or something, then obviously they're going to look at your marks. All right. But even then it's kind of like, it's actually not that important. Because let's say you want to do like a PG dip or you want to do like an MSc. They don't care what your mark was. They're just like, okay, cool. Give me the 40,000 Rand and get out of here. Come bother me again at the end of your dissertation. Like their interest is the university is optimizing for pass rates and
exactly
like you paying your tuition essentially. But like they are not like as much as they are like mental health campaigns and all that kind of stuff, fundamentally the business of a university does not care about your development as a person. It's just too big of an organization. There's too many moving parts. Like for 99.9% of the university, I am just a number. Like I am dear student, There's the people that I interact with at the hospital. They know me as a person. The rest of the university, not so much, you know. So why am I going to slave away, throw away my social life, all of that, just to keep someone happy that's never going to see me, and some fictitious employer that is, in any case, never going to care about what my mark is? And I know I'm being very outspoken about this, but I feel more confident about it now, especially now that I'm at the end of my studies. I've been here for almost 6 years. I've seen, you know, how people prioritize. I've seen the cost that they paid, the cost that I paid. And, you know, I've spent time with dentists afterwards, and they've given me, and they've also shown me, like, what life is like, and the advice that, like, they would have given themselves if they could go back. I mean, dental school is tough. We've said this a lot. There's no two ways about it. And yet I find it extremely interesting that a lot of dentists that I speak to are like, actually, like, I wouldn't mind reliving a bit of that experience. And so you have to wonder, like, is it really as bad? Like why would they want to come back? And then you realize, it's this thing of, like, there's people my age, there's people with my interests, there's people that I can relate to, which, you know, the university doesn't care about that, but you as a person maybe should. And if that comes at the cost of like 5% less on my next prostate test, that's a price that I am more than willing to pay, because I mean, it's time, it's your life. Like, you can have all the money in the world, you can never buy back your time. And so, especially now as a final year student, I'm like, you know, and I've noticed a lot of my peers as well, you know, again, kind of two groups, where one group is like, oh, this is my final year, I'm going to put everything into getting the best mark for graduation. And the other half is like, yeah, this is my last year, so I'm going to do everything that I was too stressed to do in the past, because I'll never have a chance to do it again. And for me,
I want to
at
be
least,
friends with those people.
I think I fall in the latter. And as much as my grades have admittedly gone down during the past few months, like, that's a price that I am more than willing to pay, because I think this is one of the best years I've ever had, you know, because it's like, I get to, like, the end of a Friday evening, I'm flipping beat. I had a rough week, but I also learned an insane amount. I became a lot more confident, and I just feel really fulfilled. And especially this semester, where a lot of stuff, you know, finally started clicking, it's just like, it's such a rush when things just start working out. And that for me is worth the world. And I'd rather kind of optimize for that kind of stuff going forward, having those kinds of experiences, instead of, you know, finding myself 5 years down the road trying to, like, shove my report cards down people's faces.
No one cared.
Because, you know, you realize that, like, oh, actually no one cared. But it's like, but I gave up my university years for that, so you have to care. Like, newsflash, no one has to. And so, again, I know I'm being very opinionated on it, but as someone who has been on both sides of the equation, I really, like, I tell this to younger students as well, like, obviously don't go aiming for 40s now, but what is the actual cost of that mark on your report card, and is it worth it? And I would argue, at least from my perspective,
I agree with you fully on this.
That it's
and
not.
I mean, like you said, like, we're not encouraging people to not study. Like, obviously you should study, you should try your best, but ultimately trying your best after, like, second or third year, when you get into the clinics, trying your best will ultimately get you a different result than what it did before. And there comes the point where you make the decision. Do I start putting in extra effort and sacrifice my time to get back to that high marks? Or do I just keep putting in the best I can with what I have, and maintain a social life, maintain having fun, and, like you said, optimizing for that? And I think that's the latter option is the best. Like, I don't necessarily want to be friends or associate with people that are, like, constant. This is me being opinionated, but those people are generally not fun to be around. They're constantly stressed. They're constantly, like, pedantic over small percentage changes in their marks. They're constantly worried, not that they're going to fail, but that they're not going to get some sort of like recognition or gold star at the end of their degree. And like you said, the employer doesn't care. Like, if I walk into a practice, they are not going to ask, can I see something? Can I see your marks? I mean, like, they're not going to say, can I see something that shows me that you were a great student? Something that Dr. Courtney Smith said at the Bridge program, something very similar. She said, like, what to put on your CV. And she said, include your marks, like, for fun, but no one's going to look at it. She doesn't look at it. Like, they're not going to care. And that sort of just validates what you're saying, because that's somebody who's very successful and somebody who's actually openly said that her marks were not the greatest. And she said, like, she didn't put her marks on her CV because if she did, she was scared they wouldn't have hired her. But she knows now that it doesn't really matter, you know? Like, if you really have great marks and you're super proud of it and you sacrificed everything, put it on the CV, it's fine. But people aren't going to care, because if you got 95% for every single module, but you are like shit at doing a filling or a root canal or an extraction, no one's going to want to hire you. So redirect your time and your resources to reading articles, to practicing, to doing things that actually hone your fine motor skills, your hands. Those are practical ways to actually develop yourself into the clinician you want to be, instead of just throwing all of your time at your books. I feel like it's just, that's the way I'm heading, and the trajectory I'm on. By the end of the year, I'm going to be full circle at the point that you are right now, because I feel like this year has been sort of like my road to discovering what you just said.
Yeah, I mean, look, there's also the possibility that this ages poorly, and there's one test that just completely destroys me. But you know what? I think at least in the space of this episode, I think that was like a nice a nice side tangent. But I think this is probably a good time to kind of end the episode as well. I see we've been going for a while. So as always, thank you very much for tuning back in for another week. We are slowly but surely making our way to big episode 10. And we may or may not have a very interesting guest lined up for that episode. But with that being said, thanks for tuning in for another week. See you in the next one.
Hope you enjoy the next week.